So, knowing what happens within a sole ulcer, what does that tell us that we need to do? Well, clearly once the small projections have developed on the bottom of the claw, on the bottom of the pedal bone, that's these little spikes of bone here, once these have developed, then the cow is going to remain lame. So, to me there are two things that are really important. The first is early identification of cows that are lame, and the second, of course, will be effective treatment. We've talked about the development of these spikes of bone and the hemorrhage of the corium being primarily related to bruising. So if we want to make sure that the affected claw is no longer being bruised, that there's no longer any trauma on the affected claw, then clearly what we need to do is to make sure we rest it. And one of the ways of resting a affected claw, in fact probably the best way of resting an affected claw, is to apply a block to the sound claw. Because of course if we apply a block to the sound claw, that will lift the affected claw off the floor, off the weight bearing surface, and that will reduce the amount of trauma on the base of the affected claw. I personally prefer a block like this, which takes weight on the wall. We know that the wall is the correct weight bearing surface, and if we push the foot well in and make sure that we have a really good adhesion between the wall of the shoe and the wall of the hoof, and preferably reduce the amount of weight bearing at the sole ulcer site. So I'm quite happy not to have any glue present at all at this position in the sole ulcer site. Then that will keep the wall of the hoof tilted well forward. It will reduce weight bearing at the sole, at the back of the foot, and therefore reduce weight bearing on this all important digital cushion area. It'll keep the pedal bone tipped forward on the sound claw, and at the same time, of course, the affected claw will be rested. And there are various types of blocks you can put on. That has a good firm front wall. Other block types like this one, the front wall is not quite as firm, so it's not so good for weight bearing, but what it does do is take the foot slightly further forward, so you have plenty of weight bearing at the heel. Probably the easiest sort to put on are ones like these. The advantage is that they're quite easy to stick on. The disadvantage, of course, is that weight bearing is largely on the sole if you're not careful, without transferring the weight bearing up the wall. But probably most important of all is to make sure that a block is used rather than the type of block that we use. So it's clearly prevention is very important, but that's a huge subject that we don't have time to deal with at the moment. But and that's by far the best way of reducing lameness. But secondary to that is early identification of cows going lame, early treatment, and effective treatment. Because once heifers have been damaged, once the hoof has been damaged and once the pedal bone is damaged, then those animals will remain affected for the rest of their lives. Just as a final look at a damaged claw, let's go back to a normal pedal bone here, and then an affected one here. So this line along the bottom of the bone is where the bone should end, and all of this extra bone from the solid line downwards, all of this is new bone growing within an affected claw. And clearly all of that now is pushing the corium against the hoof beneath when the cow is weight bearing. So it'll actually be pushing down in that foot, causing further damage to the corium and preventing healing. So prevention is ideal, early treatment and effective treatment is essential, and most of all concentrate on your heifers, because you need to stop this type of bone lesion from developing. So you remember that we talked about a sole ulcer being a hole in the base of the foot, and then that being translated into a swelling on the inside of the hoof. Well, in exactly the same way, if a cow has a white line lesion and a white line infection, as we see here, where the white line is split and infection has underrun the horn, underrun the wall, and come up to discharge at the coronary band. And this view, you can see that there's a large amount of new hoof, a big thickening of the wall, and the enlarged hoof is pushing against the laminar corium, which would be sitting at that point. And because it's pushing against the laminar corium, it's reducing the effectiveness of the horn. In fact, if you look at in detail, you can see that the white material at that point and at the back, that is the laminar corium in the way that it should be, whereas over the enlarged horn it's pushing so hard that it's causing an abnormality. So in the same way as when we treated a sole ulcer, we said that the most important part of the treatment was to dish this area so that it was no longer weight bearing, and all of the weight bearing was taken on the wall and back for the first third. Similarly, in the treatment of a white line lesion, we do need to remove all of this thickened horn to allow new horn to grow down from the coronary band. Because if we leave all of this thick material inside the hoof, then it will produce pressure on the corium, and that will reduce new hoof formation. So in a white line lesion, it's equally as important to get there quickly and to remove the hoof, and equally as important to apply a block to the sound claw so that this is no longer weight bearing.